Hey there, and welcome to The Explainer. Today, we're breaking down a massive, and I mean massive, strategic pivot that managed service providers absolutely must make if they want to capture the booming healthcare sector. Honestly, if your business is still leaning on a generalist IT model, you're missing out on one of the most lucrative and critical tech transformations happening right now. Let's get into it.
We need to start with a pretty sobering reality right out of the gate. Generic IT is dead in healthcare. Think about this. The cost of downtime is now hitting $9,000 an hour, and the fines for SLA negligence, we're talking millions. The existential stakes of playing in the clinical IT space completely, totally invalidate those traditional break-fix models. When a hospital system goes down, appointments literally halt. Charting is delayed. Patient care is critically compromised. You just can't risk it.
So here's our roadmap for today's Explainer. 1. We're looking at the healthcare IT boom. 2. The Microsoft Cloud Arsenal. 3. Monetizing security and compliance. 4. Redefining clinical-grade SLAs. And finally, number 5, proven go-to-market strategies.
Section 1. The Healthcare IT Boom. Let's look at the sheer macroeconomic force driving this urgent need.
Now, what's wild here is the sheer scale of this transition. Global healthcare enterprise IT spending is on a highly resilient trajectory to hit over $444 billion by 2029. That's billion with a B. This massive growth is fundamentally fueled by aggressive institutional investments in software and IT services. Healthcare executives are basically being forced to run things at two speeds right now, maintaining short-term resilience against crazy staffing shortages while simultaneously dumping money into long-term digital transformations.
And this brilliantly illustrates exactly where that capital lives, especially in the US market. Healthcare providers themselves make up a whopping 73% of the market share. They're absolutely desperate to optimize the economics of care delivery. So they aren't just buying servers and hardware anymore. They're heavily investing in electronic health records, advanced analytics, and AI automation just to combat those rising costs and all that clinician burnout.
Moving into Section 2, the Microsoft Cloud Arsenal. Exactly which tools do you need to capture this market?
Building a true clinical-grade architecture is all about resolving the historical nightmare of data silos. It's kind of like assembling a giant puzzle. First, you've got DICOM image ingestion, safely storing thousands of really complex daily radiology scans. Step 2. That ingestion automatically triggers AI anomaly analysis using machine learning to quickly spot potential issues. Third, those AI insights are injected natively into the patient's holistic health record using FHIR and DICOMcast. And finally, Step 4. Seamless clinician review. You're unifying medical imaging and AI analytics right into a single workspace, all while maintaining absolute watertight compliance.
But, architecture is really only half the battle, right? The user experience is the other half. By bringing ambient clinical intelligence into the mix through tools like the Microsoft Dragon Copilot ecosystem, MSPs and software vendors are actively tackling the clinician burnout crisis head-on. Whether you're looking at Meditech natively integrating it to reduce cognitive overload, or Software Medical using these ambient tools to preserve the psychological well-being of nursing staff, it's a real game-changer. We're talking about securely surfacing vital medical history and completely automating routine documentation.
All right, Section 3. Monetizing security and compliance. Now we transition from tech to commercial packaging.
Check out this dynamic pricing model from Cloudticity. This perfectly demonstrates how specialized MSPs wrap margin around Azure. Think about a modern hospital with thousands of connected IoT medical devices. Charging per device? That becomes a complete logistical nightmare and is prohibitively expensive. So instead, you price based on telemetry or message volume. You could scale from an annualized cost of $20,000 for baseline messaging all the way up to $135,000 for massive Tier 6 data processing. It gives your client budget predictability, and it ensures highly profitable, scalable revenue for you.
You can also completely monetize the regulatory nightmare that clinic directors face every single day. Turning strict standards like Cyber Essentials Plus and DSPT into a structured compliance-as-a-service bundle generates incredibly sticky, high-margin monthly recurring revenue. You can scale it perfectly. Capture £2,000 a month from a small pharmacy or clinic, up to maybe $7,500 for an enterprise NHS trust. You're managing their risk register, automating evidence collection, handling auditor assessments. You literally transition from being just a replaceable IT vendor to an indispensable operational and legal partner.
If you want empirical proof of why an enterprise-grade managed detection response offering is completely non-negotiable, well, here it is. Traditional antivirus just doesn't cut it anymore against human-operated ransomware. Look at this documented incident. Microsoft Defender's predictive shielding detected an adversary tampering with group policies and unilaterally locked it down. It halted a weaponized attack across over 2,000 clinical devices in under 3 hours. And the best part? 0 machines were encrypted via the targeted path. 0. That is the exact level of proactive defense your healthcare clients absolutely require.
Which brings us to Section 4, redefining clinical-grade SLAs. Promising 24/7 peace of mind is a dangerous liability here.
You have to make a high-contrast shift from standard corporate IT metrics to rigorous clinical risk management. Standard SLAs, they track uptime percentages, maybe a 15 to 30-minute mean time to respond for total outages. But in healthcare, response time is totally secondary to patient safety. Clinical safety SLAs map to strict national standards, like the UK's DCB 129 and DCB 160. Under these frameworks, a simple network failure isn't just an IT ticket anymore. It is legally defined as a patient safety incident.
Because this operating environment is so relentlessly hostile, your vulnerability management must be airtight. We're talking about fixing critical vulnerabilities within 7 days and mitigating actively exploited ones in just 24 to 72 hours. High risks in 15 to 30 days, medium and low risks in 60 to 90. Your internal escalation triggers have to track these aggressive timelines. You should literally be firing off automated alerts at 66% and 85% of that SLA window to wake up your senior engineers and prevent a catastrophic breach before it happens.
And when you fail to meet those timelines, the consequences are severe. A UK healthcare MSP was recently fined £3 million following a ransomware attack. Why? It directly resulted from sloppy security controls and SLA negligence. Having after-hours coverage gaps and frivolously managed SLAs doesn't just invite your clients to churn, it invites existential regulatory wrath that could bankrupt your entire operation.
Finally, Section 5, proven go-to-market strategies. How do we actually position and sell this?
To win these complex enterprise tenders, there are a few elite validation steps you need to take. First, secure those audited Microsoft AI Cloud Partner designations. Even better, achieve the advanced specializations in healthcare and life sciences. These badges are objective proof to a hospital CIO that you actually have audited expertise. Next, utilize pre-built industry sales kits, like the Copilot and Agents at Work kit, to really accelerate your sales cycle. But here is the absolute crucial element. You have to sell clinical outcomes, not just infrastructure. You aren't selling Azure, you are selling uninterrupted access to funding and the elimination of delays.
Let's put that into perspective. 95%. That is a real-world reduction in clinical log-on times, from an agonizing 10 minutes per session down to just 30 seconds. This was achieved when an elite partner modernized an NHS Trust digital employee experience. Just by proactively managing device health and optimizing unused software, they gave doctors back hours of vital patient care time every single day. That right there, that is the empirical value proposition that actually wins healthcare contracts.
So as we wrap up this explainer, you really have to ask yourself, is your business actually ready to meet these clinical grade standards? Are you prepared to abandon generic IT, leave it in the past, and make the strict, specialized pivot required to capture this massive, urgent opportunity in the Microsoft Clinical Cloud? The healthcare sector is practically crying out for specialized partners who truly understand their complex reality. The only question is, are you going to step up and capture it?